Hello, everyone, and welcome to the Pain Exchange, a monthly podcast sponsored by the International Association for the Study of Pain that highlights global innovations in pain research and amplifies the diverse voices of pain science. Designed for researchers, clinicians, and engaged learners, this forum will serve to inform, inspire, and connect us all together as a global pain community. Covering topics such as recent results in pain research, upcoming events for pain professionals, and much more, we are here to help you learn what is going on in the world of pain. I'm your host, Dr. Renee Chassie, the Publications Manager at IASP. Before that, I graduated with my PhD in Behavioral Neuroscience from the University of Connecticut, where I studied behavioral neurogenetics. As someone with scientific training that was not necessarily trained in pain, I am on a mission to understand the vast network of knowledge that makes up the field of pain science and explore the fascinating world of pain with experts and thinkers who are helping to shape the conversation. This month, IASP is proud to spread awareness of issues related to pain and pain management as a part of Pain Awareness Month. Today, I will be talking to you all about lipedema. Pain is often seen as a side effect of other disorders or as a symptom of some greater illness. And one disorder that does use pain as a hallmark symptom is one that many pain researchers don't actually know that much about: lipedema. Lipedema is characterized by an abnormal buildup of fat cells, typically within the arms, legs, and lower abdomen, that does not respond to diet or exercise. This buildup is often painful. However, pain researchers still don't quite know why or how. So today, I have the pleasure of speaking with Jonathan Cart, the Chief Executive Officer of the Lipedema Foundation, to try and understand this painful condition a little bit more. So hello, Jonathan, and thank you for talking to us.
Hi, Renee. Thanks so much for having me on.
Of course. So do you want to introduce yourself to us a little bit? Tell us about your background and how did you get involved in lipedema?
Yeah. So I'm Jonathan Card. I'm the CEO of the Lipedema Foundation, and I started my career working in the life sciences field, working at the intersection of the commercial and research sides of organizations in pharma and biotech. And then after that, I spent about a decade and a half in philanthropy in the social sector. The first as a strategy consultant, and then as a program officer at the Rita Allen Foundation. And Rita Allen Foundation is where I really got an introduction to the pain field specifically. One of the programs that I led while at Rita Allen was the Rita Allen Pain Scholars Program. And as a sort of an offshoot of that, we also funded and directly worked on ourselves some work to basically understand why was it so difficult to communicate about pain? Why is this something that affects millions and millions of sufferers around the world? But many people kind of discount its presence, discount its symptoms, and tend to downplay it. And so those two kind of sides of my background combined in just such a great way when I heard about the opportunity to come run the Lipedema Foundation.
What is lipedema?
Great question. So lipedema is a chronic medical condition that primarily affects women, and it's characterized by a bilateral and symmetrical buildup of fat in the legs, and sometimes in the arms and the lower trunk. Very germane to this conversation, it's often painful. The data from our patient registry shows that kind of the pain on an average day amongst the respondents to our patient registry is a 5 out of 10 on the visual analog score. So that's pain that kind of can't be ignored, is sort of in the background at the very least. And that on a flare day, the average amount of pain is a 7 out of 10. So this is, pain that significantly impacts the activities of daily living for folks with lipedema. I should mention this is a highly diverse patient population, so not all patients experience pain not all the time, right? But it is something that I think is a sort of a hallmark, as you said earlier, a hallmark of the disease in a way. And I think in addition to pain, when people talk about tenderness, discomfort, they use lots of different words to describe it, and it can also cause swelling and easy bruising. It can also severely limit mobility, especially in the later stages. So when we talk about kind of the accumulated impact of, hits to quality of life over the course of multiple decades between symptom onset and diagnosis for many people, it can really take a toll. One thing, that's unique about lipedema at the level of the tissue itself is that many clinicians and patients will tell you that when they squeeze the affected areas, when they palpate the affected areas, they sometimes feel like an unusual nodular or fibrotic texture in the tissue. And so when I say nodular, sometimes words people use to describe that include rice, peas, walnuts under the skin. Children of the 80s and 90s will kind of remember Beanie Babies. And so that's another term that I've heard people use to kind of describe the texture of it. And some other, the texture of the skin is highly variable as well. It's a pretty heterogeneous patient population, as I mentioned. So some folks will just feel almost like a fibrotic texture, like a hardening of the tissue underneath it as well. But this idea of kind of nodular texture is something that can be palpated in many patients. And then, when people undergo one of the treatments for lipedema is liposuction, so lipedema reduction or lipedema removal surgery. And sometimes you can actually see these nodular kind of chunks, hardened nodular chunks of fat, and when it kind of comes out afterwards. This is a disease that was first described in a seminal paper in the 1940s by Allen and Hines. And we talked about earlier about sort of how common it is. It's a very common disease. Prevalence estimates range, but researchers put it at probably somewhere between 5 and 12% of women. So we
Wow.
talk about it as not being rare, but under recognized. Spending so much time in philanthropy and biomedical research, seeing a lot of different disease spaces, lipedema really stood out even amidst that landscape. This is a condition that it affects millions of women, and many people struggle to access care. And that disconnect and the stories of many patients who are just dismissed or misdiagnosed for years really kind of made this feel urgent for me. It's also somewhat personal. Lipedema doesn't run in my family, but women in my family have struggled with chronic conditions that took years to be properly diagnosed in some cases. And the story of kind of not really knowing what's going on and having healthcare professionals kind of dismiss the symptoms or the experience, and then eventually having it substantiated and so like, oh, we've got a name for this thing finally. That just seemed very resonant with the stories that I hear from people with lipedema. So it's this is something that's kind of really near and dear to my heart, and frankly, it's sort of the opportunity of a career at this point to be able to work in this space.
Yeah, with a lot of pain conditions, that's what a lot of patients notice is there's just so much stigma about the hidden illness part of it, where some healthcare providers just don't believe your pain or they think it's all in your head or something like that. And with lipedema being a women's disorder, being a fat disorder, being a painful disorder, I feel like that's also true. Is that what your patients kind of report?
Yeah, you put your finger right on it. I mean, in some ways, lipedema is kind of a triple whammy of stigma, right? It's the three areas that you mentioned. There's a stigma around weight and body shape and body size. The stigma around pain, that your community will know quite a lot about. But this idea that you know folks should kind of suck it up, or it's all in their heads, or that the experience of having pain is either not real or not significant enough to care about, or both. There's that stigma around pain, and then as you mentioned, women's health conditions tended, still today have underinvestment in terms of the research, and also the seriousness that's accorded to them by some corners of the healthcare profession. So it's this kind of this sort of three factors conspiring together. I think just kind of practically what that means, in terms of the in terms of the impact for people with lipedema. Our patient registry data shows that the peak time of onset is kind of the early teenage years, so the age of 12 to 14, and the average age of diagnosis is 48 years of age,
Wow.
right? And so this is a painful condition. in many cases, and it's something that truly impacts quality of life over the course of decades. And I hear one patient after another tell me that a very similar story, which is I went to one clinician and they said it's all in your heads, and I went to another and they said, well, you're just fat, go lose weight, and it didn't listen when the person said that. I've tried everything under the sun to lose weight, and this is actually a condition that is resistant to caloric restriction, right? So I think in fact those strategies typically don't work, and so over decades these folks are seeing one healthcare provider after another, telling them kind of this isn't a thing. So I think stigma does really play an important role here. I would say on the plus side, you do hear stories from patients who have managed to find that sympathetic healthcare provider, who said, well, I don't know that much about this right now because it's an understudied condition, but I'm willing to learn more. And sometimes it was the second or the third provider that they talked to about it. And I think increasingly the story that I'm hearing from people, we don't have data to show this, but I think anecdotally it's true, is that awareness is really increasing in the clinical communities, especially a couple of specialties. And so I think it's going to be more frequent that patients will show up in the clinic with clinicians who are not just open to learning about it, but maybe they learned a little bit about it in medical school or in their subsequent training, or they encountered it through something like the Lipedema Foundation's awareness stuff.
Awesome. And a lot of our members are researchers, are clinicians. What does the Lipedema Foundation have that they might be able to look at that they can educate themselves on something like this?
Absolutely, yeah. So I think the first place I'd recommend people go to learn more about lipedema is lipedema.org. We have just a wealth of information for clinicians, for researchers, and for people with lipedema, or those who suspect they have lipedema, and their family members and friends and caretakers, right? So I think just talking about those in order. So for the clinicians who want to learn more about lipedema, we have a whole section of our website dedicated to healthcare providers, with curated content for clinicians. And the address for that is lipedema.org/clinicians. And there's a whole lot there, but I think the things that I would point to in particular are number one, we have a clinician's guide. This is a pretty straightforward 2-page, how to diagnose lipedema, how to think about treatment, how to think about referrals, how to code lipedema, diagnostic coding for lipedema, all of the very tangible things that someone who sees these patients clinically and wants to know how to kind of move a little bit further along in the continuum of care with their patients, all the things they need to know to be able to do that. So that's the sort of the clinician's guide. And then another thing I would lift up is that we have a provider directory as well. And that's something that, of course, is very useful for people with lipedema to get access to care. But I think it can also be really helpful for clinicians to have referral targets, right? To be able to refer out for specific treatment modalities, things like physical and occupational therapists who can help with some of the symptom control around lipedema. For those who are already seeing people with lipedema in your audience, I would urge them to check it out and to consider joining the directory as well. In terms of researchers, there's a whole lot that we can offer. And I think the first thing I should mention is that about a year and a half ago, we published the first lipedema research roadmap. So we worked with several dozen stakeholders, including clinicians and researchers and people with lipedema, to surface and prioritize the most important research questions that we really need to make progress on in order to really kind of crack the code of lipedema, so that we can just sort of basically discover the next generation of therapies eventually, right? And so the research roadmap, I think, is a really great entry point into the research priorities for the field. We've also got a research library called the Legato Research Library, which is essentially every paper you would want to read on lipedema. It includes not just things that you would find in like PubMed or the National Library of Medicine search, but also things that are in gray literature or things that may only exist in book form. And so it's a really great opportunity to access research. Most researchers, in addition to some knowledge and to figure out kind of like what's a toehold on the field, what's a way in, they're also going to, of course, want access to funding and to other resources that can help them do their work, right? So on the resources that can help them do their work, the Lipedema Foundation funded a biobank at Vanderbilt University Medical Center a couple of years ago, which has really been steadily accumulating participants. And earlier this year, we launched our own biobank. And so On top of that, we also have a pretty good grasp of other sources of tissue and samples that are out there in the world. And so, checking out our site, there's more information about all of those things that people can access. We unfortunately just closed a request for proposals for funding, and so, but I think, yeah, I would urge researchers to sign up for our newsletter so that they know about future funding opportunities. And also, we do sometimes consider off-cycle awards. I think especially for pain, where I think this is just a very underexplored topic in lipedema. We'd love to hear people's ideas. Reach out to us at awards@lipedema.org and share more about what ideas you have. I can't promise anything, but I think at this point, all ideas are good ideas. I think there's a lot to be done, right?
About the biobank, can people request tissue to study? Do they have to submit a proposal? What's the avenue for that?
That's a really great question. They will be able to eventually. We just collected the first samples in late March of this year. And so we're doing, at this point, quality control on the data, quality control on the samples, because we want to make sure that when we offer these as a resource to the field that they can apply to, that there's we have a good sense for exactly what we're offering them. The first piece of information folks asking for samples are going to want is just some descriptive data that says what am I likely to get if assuming my requests for samples are approved. So there's not actually an avenue to request them just yet, but I would say later this year we should have something up on our website, and I can follow up with a link around that. I think lipedema.org/biobank is probably the best place to go for more information on the biobank as it currently exists, as well as future announcements about ways to access samples.
Perfect, perfect. And for researchers that want to get into lipedema, what are some of the burning questions? How can they kind of get into this specialty?
Yeah, I think so. The first thing is I mentioned the research roadmap earlier. So there's a whole section there on pain and the nervous system and the questions that are most important to answer there. So I don't have time to go into all of the things that are there. It's a robust field in terms of the places where we need some dedicated inquiry and time and attention. I would point to, let's say, maybe kind of four quick areas that are sort of highest priority. These are kind of taking them in order. So improved diagnostics that leverage pain, better clinical characterization of pain, specifically in lipedema. We don't have much of an understanding of the biological underpinnings of lipedema pain, so that's, I think, a very fruitful area of inquiry. And then finally is pain management. And I think, on the diagnostic side of things, there was a really interesting paper published by one of our funded investigators, Tim Uko, whose lab is in Cologne, Germany, and his co-PI, Rebecca Dinendahl, using a methodology I think will probably be pretty familiar to many of the folks in your audience, which is the QST approach. And so, they, through a study where they compared participants with lipedema to those without lipedema, found that there were two dimensions of the QST that were significantly different in those two patient populations. There's an increased pressure pain threshold in lipedema and a decreased vibration detection threshold. So two were really two dimensions of the QST were significant in this patient cohort. And combining them together actually gave a pretty good prediction, from a diagnostic perspective. So this is really promising initial finding that's now being replicated by the PIs at this point. But just sort of, I think, exploring pain as a potential diagnostic is one really interesting avenue. I mentioned better clinical characterization of pain. There's a paper published basically just reporting the different words that women with lipedema use to describe the pain that they feel. So the most coarse descriptions are kind of pain versus discomfort versus tenderness. But there were 30 different descriptors, that women use to do this. And so better kind of characterization of, are these distinct subpopulations of the lipedema patient population, right? Or even just thinking about to what degree is this, pain that we would consider acute pain versus chronic pain? What's the role of central sensitization in this particular disease? I think just better clinical characterization of the pain itself would be really useful, and we're just really kind of at the early stages of that. I mentioned better understanding of the biological underpinnings of pain. I mean, I think this is just a field that's just totally wide open at this point. And I think, everything from systematic studies to understand the characterization of the electrical parameters of neurons up to, what's going on with innervation of the adipose tissue itself versus the fascia, which seems like it might play a role in this disease. Just really understanding the biology, I think, is going to be really important. And then finally, I think kind of most fundamentally, or at least most kind of immediately applicable in the clinic, would just be better understanding pain management. Which therapeutic strategies work best for which types of patients? That's a place where we just really don't know all that much right now. So yeah, plenty of opportunity. I think that's one of the things that for me, I mentioned the intense need here, the very significant unmet need in the patient from the patient perspective around lipedema care, but I think from a researcher's perspective, this is a place where every primary data paper published represents a substantial contribution to our collective knowledge about the science of lipedema, and it's a really fruitful area of exploration where people could really make a mark. So that's clinicians, and then for people with lipedema, there's plenty of content on our website for them as well. We have a brochure, which is a great first stop for just a general overview of lipedema. We have a whole section on treatments. I'd be happy to talk more about treatments if that would be useful at some point, but kind of deep diving into the different therapy modalities on offer in the lipedema field. There's a whole page on that. We have a self-advocacy guide. This is really kind of accumulating the wisdom from the folks in our patient network to understand what's worked for advocating for themselves in the healthcare system to get access to diagnosis and effective care. And I mentioned earlier the provider directory, which is at lipedema.org/providers. But yeah, lipedema.org, kind of one-stop shop.
Awesome. Yeah. And it's great to have all those resources in one place for all of these different stakeholders in the field. We actually met at the World Congress on Pain last year in Amsterdam from IASP. So, what brought you there?
Yeah, that's a great question. I mean, it's a couple of things. One, I mentioned the Rita Allen Foundation, where I worked prior to coming to the Lipedema Foundation, and so I was aware of IASP. I think we at Rita Allen had funded Pain Research Forum for a little while, which is one of your kind of companion publications, and of course we had the Rita Allen Scholars Program, and many of those folks, present at IASP and other pain conferences. So it kind of always been on my radar in that sense, or at least had for some time. But I think the other catalyst was Dr. Uko, who I mentioned earlier. I mean, he's attends the IASP meeting and is himself based in Germany, and so I reached out to him and said, "Hey, I haven't actually been to the meeting before. Do you think it'd be a worthwhile experience to show up from a learning perspective, but also just to try and let people know about lipedema and the science opportunity there?" And he was very supportive of that idea as well. So that was kind of the main impetus for it, and I just have to say it was just a tremendously rewarding experience. I mean, I got to actually try the QST, the quantitative sensory testing machines in the exhibition hall, which was fun, both as trying to administer it and also experiencing it as sort of like the patient view of it myself. So that was a very kind of a fun part of it. But I think it was also really interesting to hear about this sort of what seems like a pendulum that swings back and forth in the pain research field between a focus on the central nervous system and the peripheral nervous system. Even within that kind of dichotomy, it seemed like historically there'd been much less attention paid to pain in what I heard folks in the pain research community call the peripheral tissues. So adipose tissue being the most relevant one to our conversation today. And so to actually talk to a few folks who are doing research around, the innervation of adipose tissue and, what role might that play in disease generally, or just pathology generally, or lipedema specifically, was really interesting. Also, Dr. Hélène Langevin's presentation, she gave a plenary presentation about embracing a whole person approach to pain research, and in particular, this idea of thinking not just about the nervous system, but how it interacts with the other systems in the body. That to me was just a really compelling and kind of frame changing, it seemed, for the field proposal, which was really great to hear. The other thing was just kind of networking with pain researchers and kind of sharing lipedema about them and getting their reactions. And I kind of had two things I'd share about that. One is almost without exception, when I told people about lipedema, you could see kind of the wheels start turning and people digging in and saying, "Gosh, this is really fascinating." People put aside the, "Gosh, I haven't heard about this before." They just thought, "Well, that's a really interesting problem, and maybe this might be going on, maybe that might be going on." So that to me, I think, was really a good validation that this is a community that really does need to know about lipedema and has a lot to contribute to the discussion. The other thing that was really interesting was that a couple of times I was talking with a prominent researcher in the pain community, and I mentioned someone that we had funded to do work about lipedema, and they said, "Oh my gosh, I'm working with that person, not on lipedema, but on something else." So, Kelsey Collins, who's one of our sponsored investigators at UCSF, University of California, San Francisco, I was in a conversation with Alan Basbaum, who's been, for a very long time involved in IASP and
A very good friend to ISP, yes.
yeah, absolutely. And I think maybe received a very significant award at the meeting in Amsterdam, if I'm remembering correctly. And so was talking to him about this work. He had been an advisor at the Rita Allen Foundation. And when I mentioned Kelsey Collins, he said, "Wait a minute, the Kelsey Collins at UCSF, I'm working with her on some other work." So that was kind of sort of validation one, which is that, there are already folks in the IASP community who are working with people who we have, funded as kind of the best of the best working in lipedema. And the other was we funded an investigator named Bruce Bunnell in Texas, and almost identical story, talking to Michael Gold, who's one of the founders of the U.S. Association for the Study of Pain, also involved with the Rita Allen Scholars Program. I mentioned Bruce in conversation as one of our funded investigators, and he said, "Oh, I'm working with him on some other stuff as well." So the fact that there are already folks in this world that are collaborating with people who are doing lipedema, I think, was another just sort of strong validation that this is a good place to be.
Exactly.
Yeah.
Science is such a small community. Everybody seems to know everybody. And so, another line of work, another line of research, it's not all that hard to get into,
Yeah.
so it's really cool that we have such strong connections to lipedema very adjacently.
Yeah. Yeah.
So, yeah, but that's amazing. So, I've heard that lipedema is about to be added to the University of Michigan Pain Guide,
Yes.
um, which, for any of our listeners who don't know, is a comprehensive resource for learning about and applying evidence based pain management techniques created by both clinicians and those living with chronic pain.
Yep.
So, how did that collaboration come about?
This actually was another nice unanticipated consequence of coming to the IASP meeting in Amsterdam last year. I listened to a panel discussion about the current state of research in fibromyalgia, and one of the speakers there was Dr. Daniel Clow, who's at the University of Michigan, and he gave a great presentation, a very thought-provoking presentation as part of that panel. And so I managed to grab a few minutes of time with him afterwards, and it was great to learn from him about the evolution of the diagnostic criteria in fibromyalgia and how they took what was a pretty open-ended field a couple of decades ago and have really kind of shaped in a substantial way, I think, the rigor of research around that. But I think one of the things that came up as part of that conversation is that there aren't really great tools out there for people with lipedema to learn how to self-manage pain. I mean, if they happen to get a diagnosis from a knowledgeable clinician and then also get referred to, a pain clinic, which is, not a no-brainer. It's tough to get into those clinics a lot of times. Maybe they get some help that way and they can try different modalities, the pharmaceutical approaches, the behavioral approaches, all that sort of stuff. But for many people, they're just kind of on their own. And so he said, he told me about the pain guide site that the University of Michigan had created, which offers some targeted ideas for people with chronic pain to be able to manage their conditions themselves, and also a platform for collecting data and kind of doing research off of that. So we're really excited that the University of Michigan has decided to incorporate lipedema to that as well. And I don't know if it's been posted yet, but it's something that I think is probably coming online pretty soon. And I think one of the things that's just really exciting about this moment in the lipedema field is that research is advancing really quickly. 50% of the papers on lipedema have been published in the last 5 years. So it's really just this kind of hockey stick growth curve. And also clinical awareness, I think, is increasing. I and my colleagues have been presenting at and attending symposia and workshops and panels on lipedema in the past few years, and just in the last kind of year and a half or two, I can think of 6 or 7 standing room only presentations on lipedema. The Obesity Medicine Association meeting earlier this year, my colleague Courtney Massio, who's our professional education manager, gave a talk to over 1,100 obesity medicine specialists at that meeting, and it was literally standing room only in that room. So I think this is it's common, relatively common. It's under recognized, but I think that's something that's really changing.
That's amazing. That's amazing. And definitely in no small part to the Lipedema Foundation.
Oh, well, thank you for saying that. I mean, I think, we do invest a lot of our time and energy in especially clinical awareness these days, but frankly, the really important factor in telling the story here has been patients who have been, stepping up to tell their own stories. I mean, that happens at the individual level when they're advocating for themselves with their own clinicians. I can't tell you how many clinicians have told me that they first learned about lipedema from a patient who brought them one of our brochures, up to and including kind of, organizing patient groups and getting out there and advocating for changes at the systemic level. So we play a part, but I think we do this work in close collaboration with patients, and they're really, frankly, the ones who've kind of driven the awareness to lipedema in the recent years.
Amazing. Yeah, I've noticed that the Lipedema Foundation does a wonderful job of involving people with lived experience, lipedema patients, into the research space. So, what are some of the ways that they contribute to the Lipedema Foundation?
Oh, yes. I mean, so many ways. I mean, I think incorporating the patient voice is really central to what we do. We're an organization that was founded by a person with lipedema, and we have multiple people with lipedema on staff as our close colleagues. So it's literally built into the DNA of the organization. I think we also try to be very proactive and thoughtful about ways to solicit meaningful input into our work, right? Meaningful for both sides. And so some of the things that we do are we have patients join us and participate at our scientific retreats. At our scientific retreat late last year, the first session was a panel conversation facilitated by my colleague Casey Grosvenor. Trying to represent the patient experience to ground the science conversations that followed in the patient perspective. And we share patient stories on our site. We regularly consult them on their input on our collateral and our messaging around awareness and all that sort of stuff. So that, I mean, it's really kind of baked into what we do. And then I think a fundamental thing to take away is that we literally can't do this work without the participation of people with lipedema, right? And if we didn't have people with lipedema participating in research through completing our patient registry survey or participating in live research events at the patient conferences to help collect samples for our biobank, or participating in the foundation funded studies that are happening across the world, we'd make no progress at all. So it's a very important question. I mean, and thanks for noting that. And it's really kind of central to what we do.
And so now we actually have Casey Grosvenor here with us. Can you tell me about how you got started involved in the Lipedema Foundation?
Yeah, absolutely. So one of the primary missions you'll find out right when you go to lipedema.org is there is a brochure that we provide free copies of that to anyone that is looking for that. But that brochure was left on a literature table at a different medical conference that my sister attended many years ago. And when she saw the images of lipedema, it was a light bulb moment of this actually explains what our family has experienced for several generations. And it led to a diagnosis for me, my sister, and many others within our family. And
Wow.
I almost immediately after finding that brochure, within a month or so, found a patient conference, which is the Fat Disorders Resource Society annual conference. It is for clinicians, patients, researchers, and many others involved in fat disorders, including lipedema. And when I went to that conference, I met the Lipedema Foundation team, learned more about what they were doing. And that brochure specifically led to me finding a CLT that was able to work with my primary care and provide my diagnosis and help me find the treatment options. So that is how I came to know Lipedema Foundation. Now, I obviously work for the organization, and working with patients is something that I'm very passionate about because I've seen the life-changing impact of getting a diagnosis and learning how to manage this condition successfully.
That's amazing. That's amazing. And so basically, the Lipedema Foundation helped you get diagnosed with the condition.
That is correct. So I really encourage patients. You have to educate yourself and advocate for yourself. That brochure is a fantastic place to start, but our website has so many tools that patients can use to prepare for these conversations with their clinicians. And I think it is so important for patients to be able to articulate clearly the difference between what they are experiencing and conditions like obesity or lymphedema or even hyperlipidemia, which has nothing to do with this. But frequently, a patient will tell a doctor, I have lipedema, and they will look on their chart later and find this. So I think educating themselves on the differences between these conditions and being able to speak in an educated way with the resources that we provided, like our clinician's guide, our brochure, those are fantastic places for patients to begin. We do have a patient self-advocacy guide that I really would like for patients to look at and understand, because we help people understand what you need to do from that very first appointment with your doctor, what questions to ask. So I would highly recommend that for any patient that is kind of at the beginning of their journey.
Yeah, because it's so overwhelming as a patient to tell the doctor, whoa, hold on. I think I might know what's going on. So that kind of guide is really useful. So we're kind of wrapping up on our time together. Is there anything coming up from the Lipedema Foundation that our audience might want to be aware of?
Yeah, I will say we highly encourage patients to sign up for our newsletter, first of all, which is a monthly communication we send out, as well as following all of our social media. We are routinely providing opportunities for patients to participate in research, highlighting research opportunities for researchers to be involved in, or funding opportunities that we become aware of, far beyond just the scope of what Lipedema Foundation does, but what we're hearing in industry. And there are really so many ways for patients to engage online. We try to highlight and amplify those opportunities on a very regular basis. So, following social media, LinkedIn, Instagram, Facebook, Twitter, well, X, all of these things are exactly what we want people to do to find those opportunities to engage.
Awesome. Thank
That's,
you.
that's great. Yeah, that's probably a great place to wrap it up. There are a couple things that I would mention that we have in the pipeline but aren't quite yet ready for prime time. I think if people sign up for our newsletter and follow us on social, they'll see them when they're ready. I mentioned earlier that we have a provider directory, and we are newly expanding that to providers that diagnose and provide conservative care. So that's something that we've already been accepting submissions to, and we're going to make that public in the coming weeks. That's the first thing that I would mention. And then the second thing I would mention is that we have a few different continuing medical education opportunities in the works that will publicize for folks who are looking, even folks who aren't in the specialties that those are administered in. I think we'll find them very informative from a clinical perspective. And then one in particular is in the obesity medicine space. And so anyone in your audience who happens to also, be a licensed obesity medicine specialist will be able to actually get CME credit for that as well. So, and there's plenty more in the works in terms of the sort of the formal continuing education channels too.
Amazing. Well, thank you both so much for talking with me today. It's been so informative. I've learned so much. And I'm sure our audience will be thinking about lipedema for a while now. And hopefully, some people have been inspired to do some work on lipedema.
Hopefully, yeah, that's great. Thanks so much for doing the story. And if anyone wants to get in touch with us, they can do that at info@lipedema.org.
Thank you for listening to this first episode of the Pain Exchange. Please join us next month, where I'll be talking with Editor-in-Chief Dr. Karen Davis about the 50th anniversary of the journal Pain and what the journal is doing to highlight this important milestone.